Hey all, so this week we're going to talk about chapter 11 in the textbook about threats to internal validity. Just to remind you, right, internal validity is your ability to rule out alternative explanations within a study. So can you confidently claim that your causal factor, that the manipulation you did in your experiment is because of that manipulation and not because of external variables that you didn't think about or didn't control? Last time we were talking about some of the examples, things like confounds, selection effects, and order effects. This time we're going to talk about the remaining common threats to internal validity and the common ways we can reduce those threats. We're also going to talk about one of the very typical research designs that's used, which is a pre-test, post-test design, where you test one group and then you expose them to a manipulation and then test them again afterwards, and why those pre-test, post-test designs are problematic. Okay. So in a one group pre-test, post-test design, you gather a group of participants using whatever your sampling methodology is going to be. And we're going to test them at 2 points on a dependent variable, right? So we're going to do a pre-test measure here in blue, labeled with a dv, which is the dependent variable, so whatever we're going to measure. Then we're going to expose them to a treatment, so we're going to intervene and change them in some way. And then we're going to check if the intervention worked by measuring them again on this post-test measure on this dependent variable, okay? So we're testing a single group at 2 points in time. So let's take a look at an example of something like this. Again, remember in a graph that your y-axis is your dependent variable, it's my measured variable, and my x-axis is usually my independent variable or my manipulated variable. And you can see here in this example, we're going to study depression scores. So we've got a score from 0 to 12 on a depression inventory that we've used. And we're going to look at one group of people, and we're going to look at their depression scores before therapy and after therapy. And let's say, for example, that what we saw, so their depression scores here started around 10, and then after therapy, they had declined to about 5. So that looks like that's a pretty significant change. What are some of the problems, though? Why might somebody's depression scores go down and it not be because of therapy? Think to yourself for a minute, some possible. And let's look at another common research example. In this one, we're going to look at the effects of sugar using a pre-test, post-test design. So again, we've got our dependent variable on the y-axis and our independent variable on the x-axis. So again, our independent variable is the pre-sugar, post-sugar test. And then my dependent variable is the rowdiness score I'm going to give them. And let's see what happens to rowdiness, right? How much more rambunctious or energetic or active do kids get, for example, when they've had sugar? So lots of parents believe that kids get more rowdy or more rambunctious over time. But what are some of the other explanations, right? Why might kids change their activity level or their rowdiness level? That's not because of the sugar itself, but other things that maybe are going with it. Maybe it's things that are contained, when they're eating lots of sugar, they're also consuming caffeine. When they're eating lots of sugar, maybe they're at a party. Maybe it's an end of the year party for their elementary school or something like that. So we can see here, there we go, that the rowdiness scores went from 6 to 11. So that suggests, right, that maybe they went up. But in fact, there are lots of other explanations. Maybe it's they were at a party when they were consuming the sugar. Maybe the longer the kids are together in this experiment, the more rowdy they get, right? Because they get familiar with one another. Maybe they've responded to other things that are contained within the sugar, right? Did you give them soda, for example, which maybe had caffeine in it? So there are 6 common threats to single group pre-test, post-test designs. These are called maturation threats, history threats, regression threats or regression to the mean threats, attrition or mortality threats. Number 5 are testing threats, instrumentation threats, and then there's this 7th category of selection plus threats. So those are combined threats. We'll talk about those. Okay, let's talk about maturation threats first. Maturation threats are changes in behavior because of the passage of some longer period of time. So days, weeks, months, years potentially. So we might look at cases of growth or maturation over time. And the way that we reduce maturation threats is we add a comparison group. And then we can see, is the treatment group changing more than the comparison group, for example. So here's an example from your textbook. These are depression scores going from 6 to 20. The no therapy group in green here, you can see that their scores pre-therapy, post-therapy went down, but in fact the therapy group went down more significantly. And that may be because the cognitive therapy is working in addition to maturation, or people are sort of improving on their own because of already learned coping skills. You might imagine that the no therapy group, pre-therapy, post-therapy, just measuring them across 12 weeks or 20 weeks, maybe they're getting better because things in their life have calmed down, right? They're not in finals week anymore. The shelter-in-place order is gone. Whatever might be happening, right? They're starting to improve because external situations are also starting to improve. So that would be because of a maturation threat, right? So by having a comparison group, you can rule out these maturation threats because you know that the treatment was actually better than just what people would get by no therapy alone. A second kind of threat is a history threat. This is a change in behavior because of some external event, an accident, trauma, some new knowledge you've gained. And again, we can see here that in this group, we've got the Go Green campaign on a campus, and we measure energy usage from September to November. And then we had no campaign at all. One of the things you can see here in this first graph, right, we're measuring kilowatt hours, so how much energy people are using. And we can see that, in fact, people's overall energy usage just went down because we're moving into out of summer months and into winter months. So as temperatures fall, maybe the dorms are using less energy overall. And in fact, by having a comparison group where we had no campaign at all, we can know that, right? We know that there's something else going on that's just because of changes in usage of energy. You can imagine if you looked at dorm energy usage from November to January, it should also go down, right? Just because students are not in the dorms anymore. Here you can also see another example doing the same thing, but in this case what we see is that with no campaign at all, energy usage went down a little bit, but not as much as the Go Green campaign. So by having a comparison group that start at the same point, we can see that the Go Green campaign is actually causing more significant of a change, a larger change, than no campaign at all. The third kind of threat are regression to the mean threats, or regression threats. This is caused because extreme scores, high scores on a quiz, low scores on a quiz, you were taking a test one time and you're allowed to take it 10 times, and the first time you take it, you get a 90, and you're like, oh, that's pretty good. I've got a 90%, I'm feeling pretty comfortable. And then you decide to retake it, and the next time you get a 75. And you're like, oh man, okay, so then you keep trying, and you can never quite break that 90 again. That's because of what's called a regression threat, that the first time when you took it and you got a 90, maybe you just happened to know all those questions, you had just looked at them in the book, we had talked about them in class, but each time you take it, and let's say it's giving you new questions, maybe those questions are you're not as familiar with. The way we can identify regression threats, like with many of these, is we have comparison groups. So people, if you look at a therapy group that comes in with a really high depression score here at pre-therapy, and you look at post-therapy and you see, okay, they got better, but is this just because when you go to therapy, you go in because you're in crisis and you're feeling really bad and you want help, and maybe that's because your symptoms are really bad, and maybe again your symptoms are going to get better on their own even if you didn't do therapy. So the question is, does therapy help in addition to whatever this regression threat would be? We see this a lot when people go into their physician for pain medication. They go in at the most extreme, right, when they're really in a lot of pain. They take pain medication and they report getting better, and they attribute it to the pain medication. But in fact, it could just be that they had a really bad flare-up that day with their symptoms, and if they had just waited it out, maybe they would have gotten better. And again, the question is, do they get better more than they would have gotten better on their own when you add treatments like therapy or pain medication, right? And you can see here that the no therapy group actually didn't change at all, and this therapy group went down, but they started at very different points. So this suggests that the therapy group was going in because they were in a lot of psychological pain, and so they were seeking out treatment. When you see something like this, this suggests a regression threat where the two groups start at different levels. The fourth kind of threat to internal validity are mortality or attrition threats. The book calls them attrition threats. The quiz is going to use mortality threats, but they are the same thing. This is when your participants drop out of your study along the way. So here we've got their scores on some measurement, and at time 1, we've got the full sample of everybody, and the ones in blue are the ones that are going to drop out. And then by time point 2, what we see is we've lost people, right? These 2 at the top have dropped out, and that has changed our mean. So the mean at time point 2 is actually lower. Now the question is this because of your experimental manipulation? Is this because you gave people medication for depression that worked, or for anxiety that worked? Or is this actually happening because these people left the study, maybe because the side effects were really bad for those medications? And in fact, if you had removed these 2 individuals from this study in the very first place, what do those means look like? And in fact, in this case, what you see is if I remove these 2 individuals, the mean of these orange individuals here at the bottom is going to be not much different than the mean for time point 2. Right? So this is likely a mortality or attrition threat to internal validity. Let's look at another example. This is a similar case, right? Same kind of data, but now at time point 1, we lose 2 people in the middle, and what you can see is this doesn't actually change the scores. When you lose participants, when you're missing data, for example, because they didn't fill out your survey, or you're missing data because they didn't come back to complete your survey at time point 2, and those participants scored in the middle of whatever you're trying to measure, that's okay, and that's not a threat to internal validity. But again, if they did drop out and they had higher or lower scores, then you want to remove those participants completely from your data set. So again, the way we stop the attrition or mortality threat is by removing the pretest scores of those individuals that dropped out along the way. This is a significant problem in longitudinal studies, right? When you're tracking people over a long period of time, they move, they go on to other jobs, they are not in the area anymore, they change their phone number, or they just don't want to participate anymore. So these are a significant source of threats to internal validity. 5 are testing threats. Testing threats is essentially a kind of order effect where there's a change in the participants' scoring because they're getting better at the test maybe, or maybe they're getting more fatigued and they're getting worse at the test, whatever your measurement tool is. So there are lots of examples of this we can think about. So here's quiz scores going from 0 to 15. We've got quiz at time point 1 and quiz number 2 later on in the semester. And let's say a professor is really interested in doing a flipped classroom. So a flipped classroom is where students watch lectures online, just like you're doing right now. And then they come into class, and in class they're doing discussion activities or application exercises to really apply that lecture material. So this professor wants to know if a flipped classroom is better than a traditional classroom. So in this case, they're going to measure students at quiz point 1. Then they're going to flip the classroom between quiz 1 and 2, so right here in the middle. And then they're going to see how students do on quiz number 2. And one of the things the professor might see is that scores go up over time. And this might lead that professor to suggest that suggesting that the flipped classroom actually was better and helped students more than the traditional classroom. The problem is that this has an order effect, right? This is a testing threat, that the participants maybe are just more familiar with the testing style of the instructor between quiz 1 and quiz 2. And maybe that's why they got better, and not because of the actual flipped classroom effect. The way you would stop this is you would have a comparison group where you didn't do that flipped classroom. You would have alternative forms of the quiz between time point 1 and time point 2, so that participants are not getting better about learning the style of it. You can see in this example that might be really difficult to do, or you could use a post-test only, where you compare 2 groups of participants, a traditional classroom and a flipped classroom, and just do one quiz for both groups. I'll give you the example here with having a comparison group. So I might have in orange, I'm going to have my flipped classroom. In blue, I'm just going to have in gray, I'm going to have my traditional classroom. And in this case, you can see that it looks like the flipped classroom got a little bit better than the traditional classroom. So that allows you to identify what part of it is a sort of a testing effect, where they're just getting better over time, and what part of it is because of an improvement in how the class was functioning. An instrumentation threat is our sixth kind of threat to internal validity. This happens when the measuring instrument or the researcher's ability to measure accurately changes over time. So this could be because you had different versions of a test, maybe. Maybe you had 2 classes and you wanted to make sure that all the students in the class were not getting answers from another group of students who took the test earlier. So maybe you have two different versions of the test. Maybe the researchers are getting better or more accurate at what they're measuring. So what they're observing or the kinds of survey questions they use are actually being changed over time. This would be an instrumentation threat. Please note that an instrumentation threat is different than a testing threat. A testing threat is because of a change in the participant's performance, but an instrumentation threat is because of a change in the researcher's performance or the measurement device. Again, we prevent this by using either an equivalent form of the testing instrument. So if we have different versions of the test, we need to make sure that they are equivalent, that they have similar questions in a different order, or they have different questions, but they're in very similar in difficulty level, for example, or by doing a post-test only design. So I have two groups. I test them at one time point after being exposed to my manipulations. Maybe I have a comparison and a not. The last one are these selection combined threats. So we talked about selection threats last time. This is when a group is systematically different from another. So you allowed participants to sign up for a study, and as they signed up, the ones who signed up first went into one treatment group, and the ones who signed up second went into a second treatment group or comparison group. This is a selection threat because the participants who signed up earlier may be different because maybe they're different in psychological attributes, motivation, maybe their grades are different, and that's why they're signing up for extra credit research studies. We prevent selection threats, as you may remember from last time, by randomly assigning participants to different treatment groups. But there also are combinations of selection and all of these 6 threats we've just talked about. For example, a selection maturation threat happens because the amount of change from pre-test to post-test is different between two groups. I want to look at the effect of ADHD medication like Ritalin and Adderall on growth. So I look at young boys and young girls and I measure them when they're 6 and at 10 and look at differences and, are they growing the same amount? The problem is boys and girls were not randomly assigned to their genders. And so the amount of change between those boys and girls is just going to be different. So in this case, you would need to have some sort of comparison group and a pre-test, post-test in that case. Then there's a selection attrition threat. This is where participants in an experimental group experience greater attrition. Antidepressant studies sometimes have a pretty high rate of attrition. As much as 35% of participants drop out because of the side effects. So a selection attrition threat is when participants in one treatment group drop out at a greater rate than the comparison group. This often happens in antidepressant studies where the side effects of the medication cause participants to drop out. So you want to make sure that you're aware of that, and the way you would control for that is by removing those participants pre and post data, or pre-data, right, before if they've dropped out. The other kinds of threats to internal validity that are present in any study are observer or researcher bias, where the researcher's expectations influence how they interpret results. So they're in interviews and they're making notes about what's happening with participants, and the things that they note down, the things that they write, or the way they interpret that data and how they later score it is affected by their knowledge of their own hypothesis, right? So they're basically changing their answers to support their hypothesis. And sometimes these are not obvious. These are really subtle, and so researchers this is not purposeful manipulation of data. This is just your own bias because it's your study and you're invested in it. Second is demand characteristics. This is when participants actually figure out the hypothesis or what your study is about, and they change their behavior usually in ways to support your hypothesis. So they know what you're testing, they want to be nice, they want to help you, and they give you the answers they think you're looking for. The way we control both of these, both observer bias and demand characteristics, is by using a masked study where researchers don't know what's going on in the study, and that way your participants might not be able to figure out from the researcher what's going on in the study. Or a double-blind study where both participants and the researchers are unaware about what's happening. So a masked study is when the researchers are blind to what's going on. They don't know which participants are in which groups. And in a double-blind study, both researchers and participants don't know who's in group 1 and who's in group 2, right? Or who's in whatever your different treatment groups are. Placebo versus medication, for example. Placebo effects are when participants receive a treatment and improve but they actually improve because they think that they're receiving a valid or effective treatment. Maybe they are taking medication that they think is for depression, and they feel like they're getting better, but maybe that's because they essentially think they're supposed to get better, and so they start changing their sleep habits or exercise habits or their coping skills, and that actually results in the change, not the medication itself. The way we control for placebo effects is using a double-blind placebo-controlled study. This is where both your participants and your researchers are blind to who's in which treatment. So nobody knows except for the head researcher, who does not interact with participants at all. So the researcher is collecting the data, and the participants don't know whether they're in the placebo or the treatment group. In addition, we also make sure that there is a placebo group, right, where one group is getting a sugar pill, an inactive pill, but again, it's double-blind, so they don't know who's getting it. So in a double-blind placebo-controlled study, right, here we've got a true therapy and a placebo therapy. So in true therapy, the therapist is actually using validated techniques to walk participants through building coping skills and mechanisms to help them improve or reduce their symptoms. But in placebo therapy, they're not getting, basically they get to sit down and talk with a therapist, but they're not actually using any sort of validated therapy techniques. What we can see here is that participants actually might get better because they think they're supposed to get better, and being able to talk about and see somebody causes them to start changing their behavior in ways that improves their symptoms. And we can see here that the orange placebo therapy group from pre-test to post-test did get better over time, but that the true therapy group improved more than the placebo therapy. So this allows us to look for true therapy and placebo effects. But what we might actually do that's more powerful is to make sure to confirm that we actually have a placebo effect happening, right? Again, maybe there's a maturation effect, maybe there's a selection effect, maybe there's a history effect that's happening. So what we would also want to do is have a no therapy comparison. In a no therapy comparison here in magenta or pink or whatever color that is, we can see that people, if you just measure them over time, how much do they improve? They're improving a small amount, but again, the placebo therapy is greater and the true therapy is greater even than that. Great, that wraps up our lecture for today. Email me if you have any questions.